Okay, this is my video for the emergency care final. The first scenario I'm doing is scenario 1A, where the patient presents to the clinic following a Fuchs injury. So I'm going to check the scene for safety, and I would be wearing correct BSI and PPE, which would be a pair of gloves that I have on right now. I'll be using a SAM splint, gauze, and a triangle bandage for my supplies today. So I'm going to look at the patient's arm, assessing for open or closed fracture to make sure that there's no bone sticking out of the arm. Then I will be checking her vitals, airway, and breathing just to make sure that she's not going into shock at any point. May I treat your broken arm today?
Yep.
Okay. And then CMS, so I'm going to check for CMS. So I'll look for a capillary refill. So I'll just squeeze one of the fingers, looking for the nail bed to fill back up. And then radial and ulnar pulses. So find the pulse there, make sure I can feel it. Find the pulse on the other side, making sure I can feel it, and not pushing like too hard to put the patient into any pain. And then can I get you to wiggle your fingers for me? And then close your eyes and tell me which finger I'm holding.
Middle.
Okay. So CMS is intact currently. I then am going to splint the area. So the splint is folded and folded over so that the patient's hand can go over it. So you're just going to rest your hand in there. Take a roll of gauze, and I would use the gauze to keep the splint on the arm. Making sure not to roll the gauze too tight because we don't want to cut off any circulation. Tuck the loose end in, and then make sure that you have access to check CMS still. Then I'm gonna use a triangle bandage to put the patient in a sling. So you're just gonna hold your arm across your body in a comfortable position. I'm gonna slide this underneath here. The sling just gets tied off just behind the patient's head. Take the safety pins. Make sure to twist and pin the tail of the triangle bandage so that it doesn't get caught on anything, and tuck it in. And then we're gonna check CMS again. So I'm gonna do a capillary refill on the thumb. Wiggle your fingers for me. Good. Check pulses. Intact there. And then close your eyes and tell me which finger I'm touching.
Pinky.
Perfect. Following splinting the patient and putting them in a sling, I would send them to emergency care for further assessment. The suspected diagnosis for this is a distal radius fracture. This is the second scenario for the emergency care final. I'm doing scenario 2C. Patient presents to your clinic with the worst headache of their life. I would have checked the scene for safety and would be wearing correct BSI and PPE. The BSI in this case would be gloves, which I have on. The equipment that I'm going to be using is a stroke assessment, the Miami Emergency Neurological Deficit Checklist. So because the patient is presenting with like facial droop and slurred speech, I would call 911 immediately. Following that, Jackie, I'm just going to have you look at me and smile. So for this, I'm looking for facial droop, so like one side to not smile equally as the other side. And then I'm going to have you put both of your arms out in front of you, close your eyes, and then we're looking for one arm to drift away. Okay, you can stop, and then I want you to say, hello, my name is Jackie.
Oh. Hello, my name is Jackie.
And you would be checking for slurred speech with the patient, and then time. So I want to ask the patient when their last known well was. So Jackie, before you came in here, when was the last time that you didn't experience these symptoms?
This morning.
Okay. With the patient with a suspected stroke, I would make sure to remove tight clothing around their wrists and neck, belt around the waist, and then also be prepared to place the patient on their back or side if needed. And then going forward with that, I would be checking vitals every 5 minutes, so blood pressure and pulse and respirations, just to make sure that the patient's staying stable until the ambulance arrives. We asked the last known well was this morning. And then we're going to check your visual fields is the last thing that we're going to do. So I'm going to be standing in front of the patient. I'm going to get you to put your eyes on the tip of this pencil, and I just want you to follow the pencil with your eyes, not moving your head. So this, we're just making sure to look for smooth rhythm with the eyes and no jumping back and forth. Following that, we'd make sure that the patient gets to the hospital safely, so follow up with the hospital that they're sent to once the ambulance gets there. And then the suspected diagnosis for this is a vertebral artery dissection or transient ischemic attack, which is known as a stroke.